Hello, everyone. Today, Luis Valente is with us. Luis is actually a business manager, a strategist, and an entrepreneur with a drive for using innovative and creative strategies to solve complex problems. He's currently working as CEO and co-founder of iLoF, Intelligent Lab on Fiber, to enable a new era of personalized medicine. Hello, Luis.
Hi, thank you so much for having me.
Yeah, thank you so much too. I'll just start with some questions to introduce, to let you introduce yourself to our audience too. I'm pretty sure they're excited as I am. So, Luis, have you been involved in? Actually, you've been involved in innovation and improving strategies in companies from tech to healthcare for several years now. But you were an entrepreneur even before that, having founded your first startup at age of 18. Can you tell us a little bit about that time? Like, what were some of the trials, turbulences that you can share about that experience?
Of course. So I would like to have a very beautiful and very moving story about why I decided to found a startup when I was 18. But the truth is, I was bored. So I had just joined. I just started my university studies, and it just seemed a very very long time to until I was able to make any kind of impact in the real world. So it was a 5 year study course. So it's just very long. I was already working at the time. And basically, for me, it was all about trying and making an impact in the industry. So at that moment, the startup I founded was much less, well, impactful than the one I'm currently working. So it's a tech retail kind of startup, but still it was very very important to give me some of the basics that not only help iLoF but overall help me throughout my entire career, which is keep an eye on the product, laser focused on the value proposition to the client, and overall understand how to run a strategy for a startup from the ground up.
Actually, this also explains a lot about your business perspective and your impact perspective as well. So actually, like currently, you're the CEO of iLoF, and you had these experiences in the past. And it's a company featured as one of the most disruptive companies in Europe right now. So, Luis, can you tell us about how you managed to get that title with just a few drops of blood from patients?
Yeah, so thank you so much. Basically, what we're doing is we are collecting massive amounts of data that allows us to create digital versions of patients' biological profiles. So this basically allows us to understand how the patient reacts differently to certain treatments or to certain diseases, with the aim to help hospitals, pharmaceutical companies, and biotechs develop more personalized treatments for complex heterogeneous diseases. So we hope to transform the patient experience, overall make trials more convenient and patient-centric, and we have already been able to cut significant amount of time and cost of a couple of treatments that are now reaching the market and now reaching patients.
It's a really actually the state of the art techniques that you've been using in personalized medicine, since it's an upcoming field that's going to be a really big part of our future, in my opinion too. As someone working in this biomedical field as well. So like this, as I said, like it's a very new and complex state of the art technology that you've been using. So it will become much more impactful in the future. So can you tell us how you did? How did you decide that now is the right time to start it, since it's an emerging field right now?
So that's actually a very good question, because when you're launching a venture, one of the jokes of the industry is that being too early or too late is as good as being wrong. So if you're too early, and maybe the industry is still not mature, maybe the market is not ready to receive your product, then it's just as good as if you're just wrong altogether. And if you're late, the same thing. So the timing is really crucial in most of the entrepreneurial world. The reason why we thought that this was the right time is that never before in the history of mankind has there been such a push to develop medications for complex heterogeneous diseases that are currently untreated. There's millions of people around the globe that are currently living with conditions that have no treatment. And it's really not for lack of trying. You can take the example of Alzheimer's, where it took us almost 20 years and more than 400 clinical trials to finally, a couple of months ago, have the first treatment approved. So never before have so much money and so much resources been pulled into tackling these conditions, these heterogeneous conditions. So the reason why this technology was matured is that, number one, it allowed us to get very large quantities and very massive quantities of data at a cost per data point, which is orders of magnitude around 100 times orders of magnitude lower than the state of the art. It allows us to get reliable data, and the whole. So we basically use a combination from optical signals and artificial intelligence, and both of them also from a technical feasibility way. They reached a maturity point to be used, I would say, in large-scale applications. So it's a combination between the market is ready, the tech is ready, and there is a clear market need for using both.
Yeah, actually, it's a really cool field to work to. Like, since, as you said, the technology is right now ready and market is being ready. Actually, the iLoF proven that. But there has to be some setbacks on the road. Like in an interview, one of your co-founders stated that as an early stage startup, one of the biggest challenges iLoF faced was finding the right area to target. So currently, you're focusing on Alzheimer's disease, the most common type of dementia actually known to human. But I wanted to ask you if you agree with that statement, and if so, like how did you overcome those setbacks, and like which area to target? Like how did you decide on that aspect?
Once again, that's actually a very spot on question. So especially when you start out with a platform technology, and the technology we took to market and are taking to market is basically allows us to collect data on phenotypic data on patients. You can build a lot of models. You can create a lot of models to help further understand the biological profile of patients, how the patients react differently to a certain disease, or how they will react to a certain treatment. But getting the first initial indication, what's normally called the beachheaded market, this initial market is actually key to the success, not only of course, your first product, but of the whole company. So this was a pretty big decision. The reason why we decided to go with Alzheimer's was a mix between, again, technical feasibility. We had a lot of data that we were able to show that our platform actually performs very well in neurodegenerative diseases, and especially in Alzheimer's disease. Number two, the market. We actually had over 12 letters of intent, 3 of them from global pharmaceutical companies vouching their support to help us build this tool to help cut the time and the cost of develop Alzheimer's clinical trials. And number 3, the need. So as you know, unfortunately, Alzheimer's is one of the biggest epidemics in our time. There's a growing number of people that are living affected directly and indirectly by dementia and by Alzheimer's disease, and we urgently need disease-modifying therapies to stop it and to make sure that patients have an adequate treatment. So again, we had a tool that could be used in an agnostic way to target several therapies, but we found one that was able to provide a mix of technical feasibility, market feasibility, and a very strong patient need.
Yeah, it's a actually really nice field to work on. I'm sure of that. Like working on, as you said, working on the biggest epidemic of our lives in these days, and most of the people doesn't know it's been an epidemic for a really long time, and we have no idea how to cure it for a really long time. But right now, as you said, like with iLoF and with different technologies, probably pharmaceutical companies, a cure or it might be something like a cure is emerging to the market right now. And what I noticed that you were doing something similar with YGA and the ventures, in the sense that you're focusing on a specific disadvantaged group of people and make impact in their lives. Like Simon Sinek once said that profit is not a purpose, it's a result. Like by integrating purpose in the core of your business, you won't have to spend another day worrying about making enough profit or leaving the world better than you found it. You would be doing both of them at the same time for the whole time that you've been in business. But projects like WeWalk and Twin also aim to bring impactful solutions for United Nations Sustainable Development goals, as you do in good health and well-being. So how would you describe the purpose of iLoF? Like, what was your dream, and what was your co-founder's also dream that you've been aiming to achieve, and what's the main, as I said, like what's the sole purpose of iLoF actually in the world right now?
So the dream is really that personalized medicine is the norm and not really the exception. So when you buy clothes that suit you, that are the right size for you. But when most of medicine is still based on profiles, it's still based on the profile of the patients that were tested on when the treatment was taken to market, the average profile. And unfortunately, we're all very much individuals and we behave in different ways. So the dream is really to allow personalized therapies for dozens of complex heterogeneous diseases to hit the market and just change the patient experience for millions of people suffering from heterogeneous illness a little bit all around the globe. We want to make personalized medicine the norm and not just the exception.
Actually, yeah, it's really good to hear that, since as you said, like everyone's a different person, so we all have different physical features that we've been needing different medications, and probably having the same disease, we need lots of different medications in lots of different ways, as you said. So having like to be working in that area, it has to be nice to help those people too. Um, and right now, I can sense that like you're a team of 15 people who are very passionate about personalized medicine, as we can see through you too. People with various backgrounds and specialties, like working in different parts of the world right now. I find it very inspiring, because I think that succeeding together is way more impactful than an individual success. So how would you describe the culture in iLoF? Like, how did you manage to work and succeed together? And for the last couple of years right now, we've been all going through a pandemic. So how did you adapt and continue working through the pandemic? Since you're one of the most disrupted businesses in Europe right now, it will be very inspiring for our audience to hear that.
So first of all, we are kind of a pandemic alumni in the sense that we're mostly grown. During the pandemic. So we started most of our operations in 2019, and around 6 months later, COVID hit, and everyone went into lockdown. So most of the growth that we had was actually in this in this state. So we just had to adapt. We just had to try and make the most out of it. So first of all, having people working in different geographies, it was very, very important to have a common ground regarding values. So it was very, very important that everyone understands, number one, what we stand for, what is our mission. So everyone was very, very much aligned on this drive on changing the way personalized medicine is currently looked at and deployed around the globe. Then just common ways of doing stuff, common ways of working together. That was very important. We did a lot of exercises to find our common values, and so the core value of iLoF is be kind, And although it's a very generic value, it actually affects a lot of the way we interact with each other, and we do our work. Um, so I would say, first of all, we had to find ways to maintain a strong culture and aligned culture to uphold the iLoF values every day, even by when not working geographically side by side. And I would say it worked out all right. We were able to hire people that fit very well our culture, and we're now at a stage where we're most likely going to double the size of our team, and we're still going to keep this remote framework. And I believe this is something that is going to accompany iLoF even hopefully after the pandemic is tackled.
Actually, the be kind, the core value is really interesting for me. It's been kind of an inspirational quote too, but I'm really curious about like how iLoF team like integrating this core value in their daily lives and in their business life as well. Like, can you give us an example so we can visualize it a little better too?
Of course. So first of all, it's important that everyone understands that this is indeed our core value, and we do this in several ways, either through exercise, through group dynamics, in our offices, like spreading our works of art in our office to remind everyone that this is indeed our core value. Then you need to uphold it every day. If you don't forget that this is indeed your core value, you need to uphold it every day. And the way you do so by working with others. So when someone is having a hard time, and maybe for some reason they are having a hard time on a deliverable, then the way to approach this is actually to help the person, because be kind is our core value. So this has actually guided and helped guide a lot of the interactions with people that actually benefited from this value into growing their own personas and growing inside the company. So this is number one, the way we work together internally. And then it's embedded in everything that we do. So currently we're doing a couple of projects with hospitals where it doesn't really have, I would say, a commercial component at this point, but we are indeed creating an impact. We're solving problems that currently physicians face. So by having this impact component, as be kind is our core value, we can justify to ourselves and to our board and to our investors why we're currently working with the hospitals, even though there's no commercial component, immediate commercial component assigned to it. And this has kind of helped filter and triage through our priorities. So again, number one, the way we work together, and number two, the way we choose to work with others in the market.
Yeah, it's a really nice aspect, I think, on this core value part. So, like hiring someone to your team, you always expect them to live your core values, but get it being in the market with same guys, it will be really good for the business side and the impactful part of the your business as well. Um, and I think lots of people in our audience right now who are mostly in their university years or in high school, they all have a common they would all have a common question to you. Like, in your view, to create an impact, and what are the character traits of an impact entrepreneur should have, and what would you recommend these young people to do in their high school and university years to get ready for an impact technology career, as you've been actually, it's been going on in your life for quite some time right now. So you would, what would you suggest them to do, or what would you give an advice to them?
So I think it's very, very important, first of all, that everyone finds their own, in a way, personalized medicine, that everyone understands what do they care about, what are they passionate about. It's not easy. So it's a lot of sleepless nights. It's a lot of well, sleeping in the airports, waiting for flights. Well, or it used to be, now starting to become like that again. It's a lot about pulling all nighters. So it's not easy. You're doing something very hard, and especially if you're raising venture capital. I used to say this: the reason why someone is putting well, capital in your hand, is because what you're wanting to build is both very important and it's bloody hard. So the only way you're going to pull it off is really if you're passionate about what you're doing. There's no other way. You really need to be passionate. So for us and for me, that was personalized medicine. This was really making sure that personalized medicine is the norm and not just the exception. So if you all find your own personalized medicines, if you all find what you're really passionate about, then you have an unfair competitive advantage to everyone else. And then everything else will just be easier. Than uh, working hard, then pulling all nighters, then really put your heart and soul into what you're building. Everything will just make more sense because you're doing something that you love and you're doing something that you care about.
Yeah, I think one of the main outcomes of the session would be like finding our own personalized medicine, as you said, like finding what's our passion is. Since we're all always exploring what some different things about ourselves, I think finding one of the best thing is our own personalized medicine as well, as you said. Um, Actually, Luis, thank you so much for your time and your answers too. It's been really nice to have you here and YGA Summit this year. Um, and I'm pretty sure our audience is really inspired about you and your story since you've been 18 to right now being a CEO and a co-founder of iLoF. Thank you so much again, and have a nice day.
Thank you so much. Thank you for having me.